Facing a severe staffing shortage, UNC Rex Hospital prepares to bring back employees who've tested positive for COVID. Good evening, I'm Angela Taylor.
And I'm Russ Bowen, but that decision comes with strict CDC guidelines. Just shortly ago, I spoke to the hospital's chief medical officer about how to do it safely. Just like every other workforce around the globe, healthcare is struggling as their own workers are becoming infected with COVID-19. Just overnight, 60 additional employees at UNC Rex Hospital in Raleigh tested positive, bringing the total to more than 260 who are currently quarantined and not at work.
You don't want to delay procedures too long because then patients become sicker and then they tie up a bed for a longer period of time, or they come in through your emergency department and again, tie up the ED resources. So we look at that on a day-by-day basis.
UNC Rex Chief Medical Officer Dr. Linda Butler says as of Wednesday, the staffing shortage should improve. The hospital will follow new CDC guidelines in bringing people back to work who may still test positive, but 5 days have passed with no symptoms, including a fever, and they've been vaccinated.
So if we're closing beds because we don't have healthcare workers who otherwise feel fine, are willing to come to work, they're asymptomatic, we can bring them back wearing their personal protective equipment.
That includes non-clinical staff who are vital in keeping things running.
Definitely having our environmental services co-workers being able to clean rooms and change beds, and even our information services folks, the computers have to be running. So you need everybody there.
Otherwise, Dr. Butler says at the rate employees are being infected outside of work, things could become drastic.
We have a workforce of 6,000 people here at Rex, and 60 a day, that pretty quickly we would not be able to run normal operations if we were not able to do what the CDC is allowing.
And we heard Judith Rotano address this as far as Duke Health is concerned earlier in the newscast. I think it'll be interesting, Angela, to watch how other industries outside of healthcare adapt this as well, because it's sort of willy-nilly all over the place, whack-a-mole, it seems like right now.
But they've got